So this is recording number 2 for chapter 9. So truly, what is the importance of mechanism of injury or nature of illness? If you consider this early, it can save valuable time in how you decide to treat your patient. However, this is helping you determine what potentially could be wrong with your patient. You don't want to jump to a diagnosis right away because then you're going to potentially categorize your patient differently. You want to keep a very open mind at first. You never know when an illness causes trauma or trauma might cause an illness, so you need to figure out what kind of patient you have. Is this truly a trauma patient, or is this truly a medical patient, or you know what, is it both? But you're still going to look over the entire scene. You're still going to conduct a very good, thorough patient assessment, even though there's some unique aspects to trauma versus medical. You want to make sure that you take standard precautions when you're talking to patients, when you're treating patients. Standard precautions and personal protective equipment, also known as PPE, should always be considered based on the patient that you are seeing. If you're going to a medical call where the patient is sick, maybe you up your game. You don't just put on gloves, but you're going to put on a face mask as well, just in case the patient has some sort of communicable disease. If you're somewhere where there's a heck of a lot of blood or other bodily fluids, you might gear up a little bit more. It kind of just depends on what the specific requirements are of each call and how you want to keep yourself safe. Standard precautions have been recommended for use in dealing with objects, blood, body fluid, or other potential exposure risks of communicable diseases. So kind of our rule of thumb is if it's wet, sticky, and not yours, don't touch it. Oftentimes as EMTs, we have to touch it. There's going to be blood on arms, people are going to throw up, there's going to be situations where there might be mucus or, God forbid, some poop. I mean, people are nasty, and the situations they get themselves into are nasty. So you're going to need to protect yourself first and foremost. So put anything on that you need to effectively do that. When you step out of the rig, you should have already put on gloves, period. You're not walking up to the scene and throwing on some gloves. Protect yourself first and foremost. Keep in mind that sweat is not one of those bodily fluids that we need to worry about, but there are plenty others. Blood can potentially be infectious for days outside of the body, even when it's dried. So just because it's dried blood doesn't mean that it's any less infectious. It kind of depends on what is in it, but we don't touch it. Even, yeah. You might want to consider stepping up your PPE depending on what your dispatch information is, but doesn't necessarily mean if you end up getting into the scene and holy cow, we need to up our game, not a problem. You can always go out, regroup, get more protection on, and then go back in and adequately take care of your patient. We need to determine the number of patients, and this can actually be difficult sometimes. And not even just in the big mass casualty scenes that you're thinking of. A car crash, for example. You may have somebody that was thrown from the car. You may have somebody that is in like the back of the car. If you have an SUV wreck and there was somebody in the back seat that didn't have proper restraints on, they may have flown just into the back of the car. If you never survey the scene to make sure that there is no one else, that's a huge issue. You would think that everybody puts on a seatbelt. You would think that everybody puts their kids in proper booster seats or car seats and then has them properly attached to the car. And that's just not the case. You would be surprised at the number of people that, yeah, may put their baby in a car seat, but then just set it on the back seat. If there are kids' toys or whatever in the car, make sure you ask if their child is in the car with them or if they had anybody else in the car with them. When there are multiple patients that you can't adequately take care of yourself, you should set up an incident command system and identify the number of patients and then begin triage. We'll talk about incident command system later in the class. But triage, this is the process of sorting through patients and categorize them based on their severity. Uh, this is where we're going to determine who needs to be transported to the hospital first, who has minor injuries, who could potentially just transport themselves. There's a lot of different ways that we triage patients. Even those that go to the hospital, when they come up to the ER, they get triaged to determine how sick they are. And if somebody else needs care more urgently, they're going to be the ones that go back into the ER. Some of our patients call us because they believe that if they go by ambulance, they'll be seen faster. I have, in fact, taken somebody that for sure did not need an ambulance out to the waiting room and set them down. Just going in an ambulance does not guarantee that they'll be seen sooner. If the ER is full of at least semi-critical patients or people that require more immediate treatment, they're not going to get seen any faster than if they would have driven themselves to the hospital. You need to consider additional or certain specialized resources. Sometimes we need to call in more ambulances because we have too many patients to transport in our ambulance. I have before put 4 patients in the back of my ambulance and transported them, but none of them were in need of serious medical care. A lot of them were just severely dehydrated with nausea, vomiting, but we were coming from a nursing home and they didn't have other transportation modes, and an illness was just running through the nursing home like crazy. And so we showed up to pick up one person. They're like, oh, hey, this one has symptoms too. Oh, hey, this one has symptoms too. Oh, hey, this one has symptoms too. And pretty soon we've got 4 people in the back of our ambulance that need IVs and transported to the hospital non-emergently. And we were across town from the hospital. So, I mean, we definitely had plenty of time. But you may need specialized resources. Something like advanced life support, ALS. So you're calling in paramedics because they need IV fluids or they need medication or they need more advanced monitoring, such as cardiac monitoring, ALS. Air medical support. If you're a ways out from the hospital and you have a very critical patient and transporting them by ground could potentially be detrimental to their condition, call in the helicopter. You may need to call in a fire department who can handle like a high angle rescue or hazardous materials, water rescue if you need to have somebody extricated or cut out of a motor vehicle. If you're out in the wilderness and you need search and rescue. In Sioux Falls, we have a dual response system, so a fire truck is going to come to every call. However, if they need one of these specialized units, they may have to call for additional. Law enforcement, you may end up needing them there to assist with traffic or scene control. If you have a lot of people that you need to keep away from the patient so you could actually do your job, call in police. Have them come help you out. If there is any threat of harm or any signs of hostility, any chance that you're walking into a crime scene, police should enter first. And a lot of times we don't know what we're walking into. We walk in and we're like, oh no, this is not good. Again, exit, call who you need to call, and then you can re-enter once they say that it's safe. To determine if you need additional resources, just ask yourself a couple of simple, easy questions. Does the scene pose a threat to me, my patient, or others around, including bystanders? How many patients are there, and can I actually take care of all of these people and get them to the hospital safely? And do you have the resources to respond to all of their conditions? Primary assessment. This is the first step when you actually start talking to your patient. And even before that, you can get a general impression of your patient when you are standing in the door walking in. The goal of your primary assessment is to identify and treat potential life threats if you can. You must physically examine the patient and assess their level of consciousness, also known as LOC. So you're going to determine if your patient is alert, if they are oriented to the situation, and then you're going to check the ABCs, so airway, breathing, and circulation. Most of the times, if there's a problem with one of these three, the patient has a threat to their life. And so we do these first to make sure that we can fix anything that's able to be fixed. Your general impression, this is the start of determining the priority of care. If your patient has a very poor general impression, then you're going to want to move faster. You're going to want to get them to the hospital faster. You want to make note of the person's age, sex, and race, their level of distress, and you can look at them and see their level of distress. You can look at overall appearance and see, are they pale? Are they gray? You can kind of tell when a patient is sick just from looking at them. Note the patient's position. It can give you clues to what's going on. A person with abdominal pain tends to double over so that their abdominal muscles aren't stretching tight over everything that's lying underneath of them. A person that's having trouble breathing may be in a tripod position. We talked about that earlier as well. So kind of hinged at the hip, leaning forward, hands propping them up. Avoid standing over the patient. We don't want to come across as authoritative. Try to stoop down to your patient's level. I say stoop, not kneel. If you're knelt down and all of a sudden your scene goes down the tubes and somebody tries to attack you, you can't get off of your knees very quickly. If you're just kind of crouched down, you do have at least the ability to back yourself up very, very quickly. Address the patient by name, what they would like to be called. So, hey, what's your name today? Is it okay if I call you by your first name? Okay, well, my name is Alicia and I'm here with the ambulance. What seems to be going on today? What seems to be going on today is asking about their chief complaint. This may not necessarily be what's actually wrong with them, but this is what they have determined is the worst part of what's going on. This is why they called the ambulance. And then we want to go through and look at those ABCs just by looking at them and address any life threats immediately. If somebody's having a hard time breathing, let's fix it. If there's massive bleeding, let's fix it. You want to determine if the patient's condition is stable but potentially unstable or truly unstable. So we really actually do this in a little bit different of a manner. So your patient is sick, not sick, or could be sick. It's kind of the three that we talk about in my paramedic class. We'll go ahead and go on in the next video.